Yeah, so I thought before, we talk about, there have been a lot of announcements over the last few days, and before we talk about them, I thought it might be good to go through sort of where we are. So, as everybody knows, we're in the middle of, our third wave in the UK, and it looks like, it's kind of spreading across Europe. So we're seeing similar rise in Portugal, and sort of drops in other countries where the Delta variant is growing have also plateaued, and we're seeing rises in some areas. So it's very likely that we're in for, I guess, a fourth European wave and a third UK wave. So this is actually a graph made by Duncan Robertson, and what we're seeing is obviously an exponential rise of cases in England as well as Scotland, which I haven't shown. Yeah, unfortunately, we're also seeing an increase in hospitalizations and in the number of ICU beds that are currently being used. And that is concerning because it shows that, despite the level of vaccination we have right now, obviously the link between transmission and hospitalization isn't broken. Only 49% of our population is fully vaccinated and about 66% partially vaccinated, which means that although hospitalizations will be much lower, given the number of cases than they would have been, in March last year, they could still get quite high. What we do know is that cases are very, very high among children right now, and actually variant spread occurred very rapidly in school-age children. So if you just look at this sort of heat map and look at where spread started, it seems to have sort of started in the secondary school age group. And, these are obviously cases that we've know about from symptom-based testing. So it's very likely cases in children were higher and rises started even earlier than they were detected here. But, what we saw first was rises in secondary school children and then into the rest of the community. And now younger sort of adults and children have sort of, or older children have overtaken secondary schools. And actually, if you look at data from Scotland, what you see is if you look at the red bars, that sort of represents a Delta variant, and the green bars, which is, well, probably the Alpha or non-Delta variant, you see that there's a sort of disproportionate higher level of the Delta variant in school-age children, in 5 to 9-year-olds. And this is exactly the same pattern we saw when the Alpha variant was spreading, which suggests that children were disproportionately initially impacted by these variants where spread was happening in schools. Don't know what this looks like now. And you can confirm these patterns. You can see particularly in the Northwest, where we know the Delta variant rose early on, you can see that rises started first in secondary school children and then in other age groups, and now have been sort of overtaken to an extent or are similar to young adults. And you'll see the same pattern throughout, where perhaps not in the Southwest, but in other areas where rises started earliest in the secondary school children and then spread elsewhere. And very unfortunately, we are now seeing the same patterns we've seen before, with increase in outbreaks in educational settings, both in primary and secondary schools. And we expect that this will continue to rise unless something changes. And this sort of distribution of increase in cases among school-age children is uniform across all years. So, this is primary school, and here is secondary school. And of course, you see a bit of maybe a plateauing or something in the last few weeks, as we had half term, but rises have predictably resumed. And what's really worrying is that this is not because of increased testing. And in fact, the only mitigation I would say we have in schools, apart from sort of hygiene measures, which are not that useful, are LFT tests. And the uptake of LFT tests has dropped. I mean, this is overall LFT testing, but if you look at the data in school-age children, we can see that LFT tests are being utilized about a fourth of the uptake that they were being utilized in March, which suggests that they're having almost minimal or no impact at this point in time, and certainly do not account for the increases that we're seeing in cases. And this is what is really worrying. I mean, along with the rise in cases, we're also seeing a rise in hospitalizations in children, which I guess is predictable. Numbers are, of course, small. I mean, we have to remember these are, numbers in double digits, but we are seeing that increase mirror the increase in cases as we do expect to see, given these age groups are completely unvaccinated. Now, coming to sort of the recent announcements made suggesting that the government is planning to sort of end isolation of contacts of cases and replace it with sort of daily testing with lateral flow device tests for 7 days. And we need to remember this is happening at a point in time where case rates are extremely high in children. There's huge amounts of educational disruption. About, I think, 350,000 children or more have been out of school, I think, yesterday, for COVID-related reasons. And this is because this variant is rapidly spreading through schools. And, I keep hearing, and I think that the prevalent narrative is, so what? Children don't get that sick, they don't die. Why do we care about infection in children? Well, 7 to 8% of children have symptoms that last for 12 weeks or more. We don't know what these symptoms mean for them. Some of these symptoms are cognitive symptoms. So they have loss of concentration, memory, brain fog, the same symptoms that many adults report. And we know that there are estimated 30,000 children with long COVID now. And we think this is an underestimate because, the Office for National Statistics doesn't actually cover the whole symptom range of what we know, happens in children and adults. And 7,000 have had symptoms for more than a year. So this is not a trivial disease that sort of, is just a mild cough that lasts for a few months and goes away. It can be very debilitating, as I think everybody here knows. Very worrying that, we don't have much research ongoing in children to understand what's happening with children who are having long-term symptoms. But we do have research in adults. And I think a few weeks ago, there was research that came out from the UK Biobank, which is an amazing resource because it sort of follows up people who are healthy and has baseline sort of MRI scans for about 40,000 people, which allows us to look at what happened to their brains after infection among the people who were infected and compare them with people who weren't infected. And when we do that in a very large number of people, so in about 400 people who are infected versus 400 people who are not infected at the same age, gender, etc., we find that they have significant loss of gray matter in their brain that we can see on their scans. And because we have baselines, we can attribute this to infection because, that is the only thing that seems to have changed for them compared to the control group. And what we see is loss of brain gray matter in particular regions of the brain associated with smell, memory, and emotional processing. And these are people who were not hospitalized. Only 15 of the 400 people who were hospitalized. These were people like you and me going about their daily lives who just got infected and got tested. And of course, they are, between 40 to 89 years of age, so they don't represent children. But these are people who have adults have similar symptoms, cognitive symptoms to children. And while it's very likely children will not have as severe impact on their different organs, we can't take these risks. This is a virus that is found in the brains of people in autopsies. And even in healthy adults and children causes cognitive symptoms. And in adults, we know now affects the brain. So we need to be very careful about exposing children to this, given there's almost no research in children looking at this. And of course, more transmission means more opportunities for virus adaptation in a population that has no vaccination. The virus can readily spread. And of course, children transmit. We know even from UK data that parents of children are at higher risk of infection and at higher risk of hospitalization. Parents of children in school, that is. And as I said, the symptoms in children are quite worrying, and many of them are symptoms that suggest that they might be, impact on the brain, just like we see in adults. And these are persistent symptoms. The ones of, confusion, memory loss, brain fog are the longest lasting symptoms in both children and adults. And, we vaccinate children for flu, and we keep making comparisons between COVID and flu. And this is a study that came out of the US that shows, and the solid line here is COVID, the number of hospitalizations for COVID over time in the US compared with flu hospitalizations over, several years previously. And what we see is that the hospitalization rate for COVID were 2 to 3 times higher. So it does have, higher severe disease than flu. And if you look at the infection fatality rates, which is the rate at which people who are infected who die, that's also greater with COVID than with flu. It is low, of course, for children, but it is greater than flu. And, we keep comparing with other countries and thinking that because we have the level of vaccination that we can just, go ahead and lift restrictions and we don't need to control infection in children. And we've compared ourselves with Israel in the past. And I have to say, Israel is now recently seeing outbreaks of the Delta variant in schools, but Israel has been very, very cautious about their school policy. They learned the hard way in their first wave when they had to close schools down because of huge levels of infection in schools. And until very recently, they had mask mandates in schools well after they had vaccinated 60% of their adults of their population fully, and 80% of their adults fully. And they've now reinstated masks in schools despite much higher levels of vaccination than us because of outbreaks of the Delta variant. And, I've shown this slide before. Mitigations work. There is so much evidence that mitigations work. And the more mitigations we have, so this is a study looking at the infection rates in parents of children who were in school and in school part-time. And this is essentially how the risk in them reduces as you increase the number of mitigatory measures. So masking is the most common measure, but there are many other measures that they studied. And there's good evidence that combinations of measures, including masks and ventilations, really reduce the risk for parents of children to near baseline, which suggests that, sorry, I don't have COVID, that they have an impact on transmission. So, I mean, it's bizarre, actually, that in the midst of this entire pandemic, we have so many solutions that are being presented that involve potentially exposing children to other children who are transmitting because of suboptimal lateral flow device tests. But no, we're not really talking about childhood vaccination. And and the sort of thing we hear from, JCV and even members of SAGE is that, we need to balance the individual risk for children because impact on children is not significant. Children don't contribute much to transmission, so vaccinating them is not going to make a huge difference. The risk benefit for them individually is unclear, and enough safety data is not available. The truth is that we know that the risk of long COVID is very, very significant. Even what we know is worrying, and there's a lot that we don't know. So things could actually be much worse than we imagine. And we currently have the highest rates of infection in children and young adults. So it's very hard to come to the conclusion that children are not contributing to transmission. Also, given that rises happened in children first, and rates of absenteeism are huge. There's huge consequence in terms of impact on children, which could be offset by vaccination. And we have clinically vulnerable children who have literally no options here. They've not been offered vaccination. They are in environments where there are almost no mitigations. And now government is thinking of removing isolation, replacing it with suboptimal tests, which would very likely keep infectious children in school, increasing the risk even further for them. So what options are available to them? And about not having enough data is frankly ridiculous, because more than 8 million people in the US under 17 have received the vaccine, and we have detailed FDA reports on them. So we can't say there isn't enough data. I mean, if they don't feel comfortable about the safety profile, that's one thing. But I don't think anybody at this point in time can say we don't have enough data on the safety and efficacy of vaccines. And they are highly effective, and they are much more effective than natural infection. And this is what's really, really worrying. I spoke about this sort of policy of government to replace isolation with lateral flow device testing. And the argument is that lots of children are facing educational disruption. And that's absolutely true. But we need to think about why that is. That is because we've let transmission kind of grow in schools by removing even existing mitigations. We warned this would happen in May. Many of you signed a letter that we sent to Gavin Williamson saying exactly this would happen. We warned about Delta variant spread in schools, but mitigations were removed against advice from scientific experts, against calls from unions and parents. And we really need to look at what we're doing here. So the tests that are being used, the Orient gene test, it has not even been approved by the MHRA. It's not even registered with the MHRA. The MHRA has earlier this year already rejected the use of these tests as green light tests. So as tests that are used to permit a sort of activity versus tests that just identify new cases as red light tests. And there's literally no data on the Orient gene test in children, in asymptomatic people, and in when people are swapped by people who are non-experts, because we know that makes a huge difference to accuracy in these tests. The closest to these tests is Innova, which has far more data on it, and that's been withdrawn by the FDA, as I'm sure you're aware, for safety considerations, because it misses a lot of cases. It missed about half of the total number of cases in the Liverpool trial, and even people with high virus loads, the people who we think transmit most, it missed about 30% of cases. So we are looking at potentially keeping infected and infectious children in schools at this point in time. And it's very likely that what the government is doing will lead to a further increase in transmission, which is already a really bad situation. What I find really bizarre is that the government has gone ahead and announced this policy not announced this policy, but it's been in the press 3 days after the trials ended. So clearly, there's not been any opportunity to look at the data from the trials. And for a government that's clearly said that they're interested in the data and not dates, it's puzzling that the trials that were presumably conducted to inform this policy have not been used to inform the policy at all. Of course, I do believe the trials are completely flawed and cannot inform this policy, because the trials actually don't even assess increase in transmission in schools, because they don't measure increase in transmission in schools. So, they sort of have a predetermined outcome and wouldn't really be able to tell us the risks at all. But, the government is essentially, what I think, is following a policy of focused protection of the vulnerable through vaccination and herd immunity through letting it rip through everybody else. And that's gravely concerning, because it's extremely unethical and it's not based in any science. And what I'm seeing in the media is the most concerning. The false dichotomy that I'm consistently presented with is, so do you accept that we stop isolation and replace it with these rapid tests, versus do you want to keep children out of school with all the harms of that? So it's, do you prioritize children's health or do you prioritize their education? When we don't have to make that choice at all. I mean, the media presents isolation as the villain here, as a culprit. So isolating people is a problem, because that's what's keeping out of schools. What's keeping children out of school is actually transmission. It's the fact that we don't have any robust mitigations in schools currently. And we can actually have children in school without exposing them to mass infection, like many, many other countries are doing. But this is not an option that, bizarrely, forget the government, but even the media isn't talking about. Nobody's talking about putting mass ventilation in schools, investing those resources in schools, when we literally heard recently that New York is putting 2 HEPA filters into each classroom. But this conversation is not happening here. And there is literally no country in the world right now that's replaced isolation with lateral flow device tests. So we're really facing sort of our government's exceptionalism at its best, and false dichotomies that only serve to distract from the fact that it's their failures that led us here. And of course, we're hearing lots of stuff about harms to education of children, which I completely understand. But as so many of us have been saying for the past year, if you want to keep children in school, you have to mitigate transmission. There are no shortcuts with LFTs. Putting infected and infectious children in schools, exposing them further and hiding the problem is not going to solve it. You need to deal with the root cause of it. And, I'm not going to go through this, but I've discussed this earlier. And what we need is robust measures to tackle aerosol transmission, which is a primary mode of transmission of this virus. And even more worrying, we've seen on Sky today that the bubble system, which actually never was a system given bubbles were always in hundreds, even that is going to end on 19th of July. So at a point in time where it will be useful to actually reduce the size of bubbles, to reduce the impact of isolation, and to reduce transmission in schools, we're actually doing the opposite. So it's very hard not to imagine that we're deliberately exposing children to infection at this point in time. And yeah, that's it from me. Sorry if I overran.
That's absolutely fine, Deepti. Thanks very much for that presentation. I think